Hi everyone, so we're back here talking about the COVID programme again tonight, but also to update you about flu. So we're going to cover those two elements, firstly with COVID, then with flu, and if there's anything else you want to ask us, you know that you just can. We have Stuart with us in the background as normal, doing the producing, but also in terms of we have Chet with us as well, who's our clinical director. So we'll go from there and we can do that. We've already got a few questions on the board, but hopefully we'll be able to answer some of those as we go, and then we'll come back to them if we haven't answered them. So give us a little bit of time and hopefully we'll be there. Now, it's just a couple of minutes until we start. So again, we'll just give you a little bit of time and then we'll get from there. All right, to do that. And as you can see, some of your questions have already been posted, so you'll be able to see what they are. Let's have a look. Okay. Right, so it's now 5:30. So as I said, you've got myself tonight. We've also got Dr. Chet. So could we just turn over to him? He can give us a wave.
Evening, everyone. Back to you, Anna.
Hi, great. Okay, so as I was just saying just before 5:30 is that we're going to be talking about the COVID booster programme and also flu as well. But remember, as always, you can ask us any question at all. I'm here representing Avon Valley Practice, Chet's here representing Sarum Health Group. So if anything we can't answer from our practices, we'll come back to those for you, but also we collectively represent the primary care network, that is the organisation that organises the COVID programmes, the flus and things like that, that we do together in a network of both practices. So let's just move on to the next slide and we can go from there. Okay, so just to summarise what we've been talking about, here we are. I've jumped ahead of myself already, so we'll move on to the next slide. Great. Okay, so as I said, we're going to talk about COVID-19 vaccinations. So I'm going to give you a summary, first of all, about what we've done to date and what we anticipate going forward. Because in our last meeting, we were talking about kind of the what's, the ifs, the anticipations of pencil this in your diary, but we're not 100% sure. Whereas now, we pretty much are. So let's move on to the next slide and we can go from there. So I'm just going to summarise where we are so far, and then I'm going to look at the questions, and a lot of them, as I can see, are clinically related. So I'll be asking Chet if he can give his response to those points. So again, just to reconfirm who we are inviting into have their boosters with us. So it's all patients that are cohorts 1 to 9. Now, they are typically over 50 or are clinically extremely vulnerable to be able to do that. And we are going to talk a little bit in a minute just about those people who require a third dose rather than a booster, okay, to be able to do that. And I'll let Chet explain a little bit more about that. And that's about immunosuppression. And we do have that information to share with you. As you know, as we said previously, the earliest that we can administer the booster is 180 days after your date of your second vaccine, to be precise on that point. So you can't have it any earlier. And do remember, you have to be 28 days post-COVID as well. Unfortunately, you know, we know that Wiltshire's been hit hard with COVID recently, and you do need to be 28 days post. A lot of you would have received text messages to be invited into the clinic on the 16th of October. And indeed, in total, 1,185 people were vaccinated on Saturday just gone. And indeed, the other people are those few patients and also members of staff who have also been vaccinated through the programme. We are only vaccinating with Pfizer. So I know there's a question in a little bit about having been vaccinated first time with AstraZeneca and what that may mean. So we'll ask Dr. Chet in a minute about that. But importantly, our next clinic is on the 13th of November. OK, I'm going to give you some other dates. Now, our systems only allow, even though we've got all of our appointments on the systems ready, they only allow you to book up to 3 weeks in advance. So those appointments are going to be available for you to book from this weekend onwards. 13th is this Saturday, 14th is this Sunday, OK, that you'll be allowed to book. So we will be sending you invites out again to book those appointments. Okay, if you get vaccinated elsewhere in the meantime, and we know that that's happened to some people, please do cancel your appointment. It's critical that you do that as time to enable somebody else to have your vaccine. So please do that. We understand choice. We understand that you can go to different places to get vaccinated. We understand that. We would love you to come to us at Lark Hill. You know the setup, you know us. It's like a little community of people together organising that, but equally understanding your choice and your abilities to be able to do that. So that's where we've come from. So before I go on to the next dates, I'm just going to look at the questions, and I'm just going to ask the first one, which is from Ray Chet, which is, I had AstraZeneca first time due to allergies. Will I get it this time?
Hi, Ray. Actually, the vaccine that has been licensed for the third dose is Pfizer, so it's not AstraZeneca. So all the doses will be Pfizer, whether you go to the City Hall or whether you come to us. Regarding your question regarding allergies, it may be worth you speaking to your own practice to see what those allergies are, because actually, as we've now been doing this for the last 10 months, we've actually found majority of patients can have the Pfizer vaccine because the ingredients are so small that actually many people aren't reacting to it. So it may be that because of all the data we've had for the last 10 months that the number of reactions is so low, it might be worth you contacting your practice to see whether you're still allergic towards it. But apart from that, whether you go to the City Hall or whether you come to our service, all the third doses are Pfizer. Anna, whilst I was here, I was going to answer the question about the immunosuppressed, if that's okay. I'm getting a nod. So I see a gentleman called Dave has replied saying that you've been invited because you're at increased risk. So there is a cohort of our patients in both Avon Valley and Serum Health Group that are immunosuppressed. Those patients that are receiving chemotherapy, renal replacement therapy, they're on different sorts of medications that's making their immune system very weak. What has come out is that these patients will be having a third dose, not a booster. And what Avon Valley and Serum Health Group will be doing in the coming days is running the reports in the background and feeding that information to the NHS so that we can get you vaccinated. The likelihood is that the NHS would like to vaccinate you so quickly that essentially we may be passing your names over to likes of City Hall so that they can conduct your vaccination quickly, maybe even before the 13th of November. So you'll get notified directly from that service. So we are running through the reports in the background. As you can imagine, they're quite vigorous because we need to make sure the right patients get the right vaccine at the right time. So I'll pass that back to Anna.
Thanks, Chet. Okay, so whilst going through those questions and Dr. Chet was explaining those items, I've gone through and answered a few of your questions, but I wanted to talk about Duncan's question. So he's asked about the little cards. So do you remember when you had your first and second vaccines, you were often given kind of a little card that told you the date of your first vaccine, your expiry date, batch number, etc., and then you got your second one. The NHS haven't reissued those cards for a third dose. So what we did on Saturday was offer them that all the clinicians had those cards available to them should one of the patients wish to have a card with that information on it. And of course, things have moved on progressively since that time back in January when we first started. A lot of you now have the NHS app. A lot of you have kind of what we call the vaccine passports that give you that information already to hand. Those cards do not have any kind of official purpose, as you say. It's to give you the information so you've got it easy to hand about what dates you had your vaccine. So they're not something that we promote. Again, I think they're a little bit misleading in terms of having just first and seconds and no third option, you know, which box do you put it in? But we did give that availability to the clinicians should they feel that, you know, that patient who was with them required that date to hand. So that's why we used them. on that point. Yeah, and then the COVID passes, yes, they currently expire on the 20th of October, and then you have to get them updated, and that kind of works, but that's a national system, okay, to work with. So hopefully, Duncan, I've replied to you about that. Now, I'm going to just move on to the next slide, because that relates to Nigel's question about when the next booster sessions are and what's happening. So if we can just move on to the next slide, Stuart. Okay, so what we anticipate is the 13th and 14th and the 27th of November, and then the last session being on the 4th of December. We expect all of those dates hopefully to be full, and therefore everybody will get vaccinated completely and in line with their 180 days. Remember, Chris Whitty has clearly said that you can be vaccinated for your third booster between 6 and 10 months, okay, to be able to do that. There's, people have come to us worried about, they're going to be 183 days over, and does that mean they're going to lose their immunity? The NHS have been clear on that. It is between 6 and 10 months. So if you miss a session because you're on holiday, and luckily we're in that position now whereby you can go on holiday to be able to do that, then of course there are other options to have that vaccination later. I think the important part is you can't have it earlier than 180 days, but you can have it up to 10 months after your second vaccine. So that's the important part going forward in terms of that to look at. So we can declare that these are not anticipatory dates anymore. They are confirmed dates. The NHS have agreed that they will supply us the vaccine for these dates because they know our numbers and where, therefore, in terms of number of people and being as efficient as we can with the vaccine, bearing in mind the cost of transportation, delivery, etc., we're able to offer this to you. So we will be sending out the invitations for the 13th and 14th of November, and they will be going out this weekend, so you should be able to book them to be able to do that, okay, to look at. Now, if we find that everybody's booked them and we've got some more, we will be asking if we can get some more vaccine, but at the moment it will be on the cap numbers that we have to date. Okay, for that. We're also working alongside our home visiting team that comprises 2 paramedics and 2 pharmacists who are coming out to people who are housebound to vaccinate them at home alongside their flu jabs. And we'll talk about flu in a minute, but that's what's happening shortly. We have various different meetings to make sure that we get this in place for you safely. So you'll be hearing from the individuals about when your vaccine will be. But we know that you're at home and safe at the moment, so we're coming to you as quickly as we can. So I'm just going to have another look down the questions about the COVID programme, and it looks like they've all been answered, so that would be great. If you do have a question about the immunosuppression, I think that that's quite an important part. I know for Avon Valley we've got 314 patients who fall into this category. We understand a lot of them, I think over half, 182 of them had appointments booked for this Saturday. So of course that's why we were waiting to make sure who could come in and who were doing what to hand over. I don't know, Chet, have you got the stats for Salem Health Group? No. So okay, so in terms of that, sure about Salem Health Group, but believe me, it's all okay. It doesn't really matter, because importantly, you have either had your 3rd dose or will be invited to get your 3rd dose shortly. So do not worry on that front. Moving on then, into the next part of the presentation will be about flu. But if you think about anything about the COVID booster programme whilst we're talking, then please do ask the question and we can come back to it at the end. So let's move on to flu. Okay, so as you can see, Chet is not Sally. So in that respect, Sally is their practice manager who can't be here, but Chet is here, so that's the most important. So let's move on to the next screen. On that front, so what we know in Valley, so we're going to take it in turns to speak about each practice, about where you're up to, because the flu programme is slightly different to that of the COVID programme. As you know, some of you have been coming to Lark Hill to be vaccinated, and that's when the 2 practices work together to vaccinate out of hours. That's usually a Saturday, whereas there's other appointments in the surgeries, predominantly at Millstream for Salem Health Group and for Uphaven and Durrington in Avon Valley, to be seen during the week. So in terms of that at Avon Valley at the moment, we've vaccinated at 1,285 patients so far. Okay, you know your groups, you've been vaccinated in previous years. They are the classic groups, and if anybody would like any more information about that, we can ask Chet in a minute. What I thought was important here was to say that we've got 475 patients booked at the moment who are aged over 65, who are booked on the 6th, 9th or 11th of November, but there are still 575 yet to book. Now we're going to talk about that in a minute. Under 65s, we've got 338 patients booked for the 6th, 9th and 11th of November, with 2,755 patients left to book in terms of that. And again, hold that thought because I'll be back to you in a minute. 58 patients need to be vaccinated at home, so they'll be vaccinated through the COVID programme that we'll be working on over the coming weeks, and indeed also 57 out of the 197 children. So in some respects, our uptake has been great, it's been good, but in other ways it hasn't. And we do know that the NHS has been pushing to get the flu vaccine this year. There's a lot of worry about the respiratory viruses that are kind of widespread and moving through our populations very quickly. So, and indeed, we still have appointments available for the dates that are free at the moment. Now, we've been given some updates about the deliveries, and you know that we had delivery delays previously. Now, we've had a couple more, but we think that we can still vaccinate according to this. So there's no need to worry about your appointments as yet. If it does affect you, we will come out to you directly. We hope that it doesn't at Avon Valley. We've done the work, the stats in terms of that, to ensure that we've got enough vaccine to guide us through to do that, but we won't have enough for the 2,755 under 65s, because of course the government extended the programme to cover 50-year-old plus as well. So our biggest question that we think is going on at the moment from an Avon Valley perspective, but we think for Sarum Health Group, and I'm sure Chet will ask about that in a minute, is about, have you had your vaccine at the pharmacy? Because if you have, I don't think that we've necessarily been told. So you'll keep getting invitations from us saying, please have your vaccine, please have your vaccine. It means that that information is not in your medical record. And really, it's important that it is. So if you've had your flu vaccine and you get an invite from us, please do take that bit of time to reply back to say that you've had a vaccine already, because I think it's really important for us to capture that information about what's happening and to feed that back, because you know, your medical records are your being, are your way of getting healthcare and appropriate healthcare wherever you go. So it's important that we know whether or not you've had your flu vaccine done. So we'll come back to this in a little bit, but as you can see, this is what's been happening at Avon Valley for flu. We've still got a programme, still book your appointments, please, they're still available. We're going to get through that and do that, and we'll go from there. So Chet, over to you.
Hi everyone. We've had a very successful drive with the flu vaccination. We've got dates coming up on Monday the 1st, Thursday the 4th and Monday the 15th. We have enough vaccine for all those clinics. We are in the same position that when we know where the next set of vaccines are coming, we then arrange further follow-up appointments. Two things, don't panic. Vaccines will be coming at some point future down the line, but more importantly, if you have been vaccinated already for flu, please let us know so we can definitely check and sign you off, because as Anna is saying, we're not getting notified 100% of the time every time it's happening in the pharmacies. So as vaccine is short due to all the issues that have gone on in the press, it would be great to know who's already had it so that we could then tick them off so that we can use that vaccine for someone else. So I'd urge you to get in contact with us if you've been to a pharmacy. Right, over to you, Anna.
Great, thanks, Chet. Okay, so that's the most important thing, really. Tell us if you have had your vaccine already. Please don't phone to tell us. We do need it in writing that you've had it, just in case the reception team, etc., misunderstand the information that you provide to them. So please do that. We are looking at an electronic way of doing it, but you know, it's just trying to get everything sorted and set on that front. So please do book your appointments, particularly children's flu. I was quite surprised by the lack of uptake. We have had appointments and appointments haven't been being booked. So please do get your children vaccinated. It's the message coming out from the NHS to please get vaccinated. We have quite a lot of poorly children, as we call them, hot kids, that have got various different viruses picking up because, of course, they've been so protected with lockdowns that they haven't had the exposure to the viruses that are normal for most winters going forward. So please do get vaccinated, and I think that's the important part. So don't worry, should be fine and dandy. We'll see you on those dates as booked, but do ensure that if you haven't had an appointment to book it, and to go from there. Okay. So here's a good question. So if we can just go back, Stuart. Go on to the questions page, please. That would be awesome. So we've got a couple of questions. So Sam said, and I think this is one for you, Chet, I'm worried about having COVID and then the flu vaccine. Can you answer that, Greg?
Hi, I'm worried about having COVID and then the flu vaccine. So essentially, I'll try and answer it in two ways, thinking what that question is. So if you've had COVID recently, i.e. the actual virus, then you should at least give yourself some time to recover. We would say that your third booster, we would like you to wait at least 28 days afterwards before you can have it. So if you've had COVID recently and you're feeling well, because flu isn't inactivated, I would give yourself some time before you have the flu vaccination, and it can be anything from 2 weeks, 3 weeks. I'm going to take the question in a slightly different way. If you've had the COVID vaccination, can you have the flu vaccination? And actually, that has been the big change from when we originally did the initial vaccinations. You can have the COVID vaccination and the flu vaccination together. So there doesn't need to be a space between the two. And that has been a big change since the update came out. So I hope that's kind of answered that question for you, Sam. But if not, you can always repost back. I could try and answer it a bit better. Back to you, Anna.
Hi, thank you. So the next question comes from somebody who's anonymous, but Chet, it's for you too. So as a patient at Lark Hill, can you confirm if there are appointments available for the flu jab? Oh, sorry, just moved for the flu jab, as I'm yet to receive an invite. I am under 65.
There it is. Yes, so get in contact with us, and we will see where we can fit you in. But if not, we will then take your details and then await the next set of vaccine that comes through. So we have enough for the current people that are booked in. If you believe that you should be on the list, then please do get in contact with us. Back to you, Anna.
Hi, great, cool, thank you. So I think we've answered all the questions that have been posted just now. So I just want us to flip back to those dates, Stuart, just to remind everybody when that when the COVID clinics are coming, to be able to do that. Okay, so 13th, 14th, 27th of November, 4th of December. We will invite you into those appointments. Remember, you can only book 3 weeks in advance. I don't know why the national systems have booked it like that. You can only book 3 weeks in advance, but that is what we're dealing with. So please don't worry. I do know that some patients kept receiving text messages and then would go on and then say, well, there's nothing to book, there's nothing to book. And I'm really sorry about that. There was a bug. I think we have sorted that now. But thank you to those people for bringing it to our attention, because it's one of those things you kind of think that everybody knows, but actually we don't always know. So it's really important to share. So thank you ever so much for telling us about that, all of those of you that did, because we have been able to fix it and sort it on that point. So these are the fixed dates. You know what you've got. You can book those dates coming forward, but they'll get released 3 weeks prior to actually the go live date, because we can't make it any sooner than that. So yeah, we'll be in touch about the COVID boosters at home. You'll be hearing from our clinicians about that directly for those who are going to be vaccinated at home, and we'll go from there. But thank you ever so much for your time. We've answered all your questions, and yeah, and take care, and we'll see you at one of the clinics shortly.